my director, Angelina Skinstad, is going to be presenting on this, and we want to welcome all of you. Again, my apologies to those of you who are joining that normally I can turn this doorbell off, but it's the codes are not working for me today, so my apologies that you are hearing that doorbell as people join, but hopefully once we get started we won't hear that anymore. So okay, well, I think I'm going to pass things over to Dr. Angelina Skinstad, and she is going to give us an overview of all of the programs that we have through our various TTC projects. So Angelina Skinstad, thanks so much, and I'm going to pass things over to you now.
Thank you so much, all of you, for joining us in this time of a very serious pandemic. I know you all, as we, are very concerned about what's going on around us, and I'm sure you all are more or less working from home like we are, but also when Kate says she has a problem turning the doorbell off, this situation has created an enormous pressure on the internet. So I think that's part of what's going on as well. I was asked by the National Indian Health Board to introduce some of the things we are doing, and I'm also going to give you some examples of how we do this and what we are thinking connected to this pandemic, because I'm sure as we have to really make some quick adjustments as to what we usually do and prefer to do, which is the face-to-face variation of a training, and now we may not have that opportunity for quite some time. And so let's see, here we go. We have 3 technology transfer centers. The old one, as I often refer to them, is the Addiction Technology Transfer Center, and we started the National American Indian and Alaska Native ATTC in 2012. However, I'm sure you can hear, I have an accent. I'm Norwegian. I immigrated to this country because I married an American. I'm a clinical psychologist, and I started working with Native communities in the upper Midwest in 1998 when Dr. Dwayne Mackey was the director of Native American initiatives in our center. Some of you may have already known about him. He has a lot of initiatives that we have continued and are updating, and I will address those as we go. But he was a very important person, and he passed away way too early, and even though he worked with us for 12 years, it was way too early. We have created a Center for Behavioral Health, which is sort of like an umbrella organization where we have a leadership team, and Kate on the line here is part of the leadership team, as well as Sean Bear. And we are in the Department of Community and Behavioral Health, and we have administrators from that department supporting the center. And of course, we are in the College of Public Health, and we use a number of resources and people in the college to work with when we are doing our initiatives. And one of the things that I want to say about that is one of the main approaches that we use in our thinking and in our initiation of projects is based on community-based participatory research and programming, and the tribal variation of community-based participatory research. So we lean on some of our colleagues for assistance and support. One thing I want to address with you, and that is my dear friend Gideon Zamba. He's a tribal member from Toga in Africa, and he runs a program in the Department of Biostatistics in the summer for students of color. And he and I talked about this in the picture of we need to have tribal communities do as much data collections as they can. So if you have anyone who might be involved in the summer program, he is a fantastic teacher, and he's only had one Native student. And there is something wrong with that.
That was Africa?
So, yes. So here is the complicated structure we have. And you can see both my name, Sean's, and Caitlin's name as the leadership team. But in the group, leadership group, is also Rossi, who is in charge of the Leadership Academy, something that I am going to talk to you about. And Matt Ignazio is an assistant director and working on very many of our projects. And as you can see, we have 3 centers and 2 supplemental grants that we will address. Okay, I need to, we have an advisory council group that works for the whole organization, and then specifically some of them are involved with the ATTC, the PTTC, or the MHTTC, and we have tried to be as geographically representative as we can. And I would say there is 1 non-native advisory council member. All the others represent different tribes across the country. And we don't use our advisory council members as window dressing. We use them a lot. So we call on them. We are asking for their suggestions, etc. We also know that working with Native American communities, we need to be working with people in the federal government. Is there an echo for you all? Okay, there he went. So Karen Herod, who is a regional SAMHSA administrator for Region 6, Juanita Mendoza, who is the Bureau of Indian Education, Rose Wiaki, Urban Indian Health, and Captain Hunt, who is in the Associate Director of Behavioral Health in IHS. All of them are involved, very much involved with us. We have also an extended group of consultants. These are just some of them, and some of them are involved with our Leadership Academy. Some of them are involved in direct TA, and some of them are part of specific centers across the country. We also have subcontractors across the country, and here are some of them. And they work with all 3 centers. So let's go through some of our projects. And the first one that I want to mention is the American Indian Alaska Native Leadership Academy. This is a program that I used to run as an ATTC director when we were in a region called Prairieland ATTC, the Upper Midwest region. When we got the grant for the National American Indian and Alaska Native ATTC, I convened a group of Native leaders who had been part of our Leadership Academy before and who wanted to be involved with us. And we sat down with what we call the Leadership Institute in the old days, and we went through it, picked it apart, and developed the cultural adaptation of this. This is still a work in progress, and we have gone from this being a 6-month program to a year-long program. And here is an overview of what it is. We recruit from the prevention field, from the mental health field, and the addiction field. And this time we have 11 mentees and 11 mentors. And the way it's laid out is we will be convening always in the Meskwaki settlement here in Iowa and have a 5-day immersion training. And during that time, we pair up mentors with a mentee, and we start helping them develop an individual leadership plan and a project plan. And during the year, in between the face-to-face meetings, our mentees and mentors meet regularly, and we have regular webinars based on the topic that people expressed an interest in. And that may vary from year to year. We just finished our immersion training, or our enhancements training, sorry about that, and we were in Tamaya Resort in New Mexico, and I get very proud every time I listen to these projects because the mentees had developed projects that really will be helping communities and also move the field. So just stay tuned when we are finished with the graduation session, which will be in September. We're going to be promoting some of these projects because they are fantastic, to say the least. And it involves anything from suicide prevention programs to developing prevention initiatives to establishing a detox unit in the tribe. I mean, a lot of things that there is all reason to be proud of. We also are trying to work with tribal colleges, and especially because we want to enhance capacity out in the regions. And we would love to be able to offer support for tribal trainers to train in the region and through the tribal colleges. And this is a project that is a long-term project, but we will get there. And we are planning TOTs and exchange of faculty members so that they can feel prepared to offer a behavioral health course. Let's now go to the individual technology transfer centers. The oldest one is the National American Indian and Alaska Native Addiction Technology Transfer Center. And here is the map. The map is giving you an overview of 10 regions across the country, and they follow closely the DHHS regions, and you should have a region where you are living, and you should reach out to them and make sure you are involved with the different training and TA opportunities that they offer. Here is some of the staff we have. And here are some of the projects that we offer through the ATTC. One thing that I really want to highlight that we have heard from tribal community members or urban Indian native communities, that it's important for addiction counselors to be able to pass the certification or licensure exams. And we have regular offerings of the alcohol and drug prep course. This is a course where we drill on basic knowledge and knowledge about multiple choice. And when we have offered them, we've seen that the pass rate have gone up to about between 60 and 80%. So this is the program we have offered for many, many years, and also updated because, as you know, these licensure exams, they change, and we want tribal members to be prepared for the changes. We also offer webinar series in behavioral health, and the essential substance abuse skills training is also a webinar series that is intended to prepare providers to sit for the exams. Of course, we are focusing on medication-assisted treatment. We try to do all our training and TA within the historical trauma and trauma-informed care model. We also offer newsletters, and the two last newsletters, to nobody's surprise, has been focused on opiate addiction, and addressing the opiate crisis was our Recovery Month issue. And in February, we just offered a new issue and discussed the origin of the opiate crisis and included a lot of resources within that. We had a few success stories in that newsletter from the TOR grantees, and all of this is accessible through our web pages. If you want to be included in our listservs, please let us know, and you will get them more quickly than when you have to wait for them this to be uploaded. We have a program called The Importance of Spirituality in Treatment of Substance Use Disorders. And we were to have this program in mid-March, and of course did not happen because of the COVID-19 pandemic. So now we have decided to offer it online. So we had a very interesting discussion on the issue of spirituality last Friday, and the next one comes Friday as of a week from now. And we have a group of spiritual leaders, medicine men, and behavioral health professionals who are sitting around the table and discussing cases and discussing the importance of understanding spiritual needs when we work with a person with drug and alcohol use disorders. We have one program that I want to highlight for you, and it's the old Dr. Mackey curriculum on cultural sensitivity. And this one will be offered when we have revised it to be, and we hope that we can recruit trainers from different regions who can be trained by us and offer it regularly to non-native providers working with clients with substance use disorder. And the other thing we've just finished is we have created a specific motivational interviewing training program, and we will offer learning collaboratives afterwards. It was piloted in California before the pandemic started, and it is now, we're trying to work on how to do some of this virtually, but also hopefully at one point be able to do face-to-face training, because it's, as you can imagine, we are testing and training different ways of using motivational interviewing, and it's very hard to do that via Zoom or Adobe Connect. But I know somebody might be able to do that. One thing that I want to bring up for you all during this very, very hard time is that I think our addiction counselors really need support. Some I know have had to close down inpatient units. Others are working via telehealth to connect with their clients. And for that reason, and the loneliness of us all sitting at home has made us decide we're going to start figuring out how to offer this virtually and do it fast, because people are very stressed and concerned about their working situation. So that's something that we will inform you all about when we have it ready. We also have the contract to provide tribal opiate response technical assistance, and the TOR TA Center is our staff is Jeff Ledalter, and we have a student called Bikera Ikoba, and then we are working very closely with JBS International staff. And as you know, there are two cohorts, October 1, 2018 and October 1, 2019, and as you know, there will be more. What we have done is we started off by a lot of webinars to address the expectation that the tribes needed to develop a plan, if not the strategic plan, and we also tried to connect it to the tribal action plans. We continue to offer regional meetings, and we are very happy with those because providers are able to come together, share their challenges and their success stories. And I think the last one was in Oklahoma, and again, just before the pandemic and the social isolation and distancing started. We had planned one in the Cherokee Nation of North Carolina and in Maine, and in Alaska. We have already been in Alaska once, but again, we are trying to find alternative ways of doing this. So the National American Indian and Alaska Native Mental Health Center started in 2018, and again, it is different organizations offering mental health support from addiction support, but some are overlapping. There are 3 centers, Central East, Great Lakes, and us, that have all 3 of these grants. And here are some of the staff. We are working very closely with students, being in an academic organization, but also with consultants. And here are some of the projects. These centers have, as I said, an umbrella advisory council. So some of the advisory council members are focusing specific on mental health issues, and others on prevention or addiction. Here are some of the projects. Sean Beer, together with Ray Daw, Sean is a Meskwaki member, and Ray Daw is the Navajo. And both of them are from the armed forces. And together they, and mostly Sean, developed a very extensive veterans curriculum where we focus on how to heal and support the returning warrior. And we have done that many, many times the last year. And the last time was again just before the social distancing mandate started. And what we've discovered is that this has been a healing for the participants who are actually in the audience, returning veterans in the audience. But it was also intended for behavioral health professionals working with Native veterans. So I think this is going to continue to be offered, and of course it's now a webinar series, and it's going to end up also being the next topic for our newsletter, mostly focused on PTSD. We have always offered training and technical assistance to providers working with the Native LGBT Two-Spirit community. And we had, again, planned a TOT, but unfortunately, we've had to postpone that, but it's something that we really look forward to being able to increase capacity out in the regions. So we don't have to travel, but we will have Native trainers in the regions. Here's another project that I think is very important. We have a lot of requests for how can we implement, how can we prepare, how can we evaluate a new project. And we had a 2-day training set up in San Diego called Project Enhancement and Implementation Learning Collaborative. We're working on, again, finding alternatives to this because face-to-face, we don't know when we can do that again. We have been very involved in some suicide prevention task force and worked with several tribes with suicide epidemics, and we're going to systematize this a little bit more in collaboration with other organizations working on this. But we have a special way we do this to make sure we are supportive and not overwhelming a tribe when a difficult situation like that comes up. We have, again, webinars, we have newsletters, and as you can see, the 2 topics that we had from last year and this year is suicide and trauma, finding a way to heal, and early and high-risk psychosis. The next one is going to be on post-traumatic stress. We're working with a lot of other organizations in the country, both outside and within the Native community. And the reason is that, as you may know, a lot of communities have no acute beds or have to rely on outside psychiatric inpatient treatment. And we've seen some concerns, or I have seen some concerns about how limited the knowledge is in these psychiatric institutions on how to work with Native patients with mental health disorders. So the National Association of State Mental Health Program Directors is quite crucial in this because we want them to really understand how to work with Native clients with substance use disorder. here are some of the suggestions we have for further work. And one thing that I wanted to highlight, in this day and age with all the telehealth needs, we also have worked with the Center of Excellence in Albuquerque to collaborate on how to support tribes in implementing telehealth. We have a supplement that was awarded us and all the other mental health centers, and that is the K through 12 supplement, the school supplement we talk about. And here are some three of the faculty and staff on this project. Jackie Gray is a person we work with on several projects, but this is one that she's been very involved in. And we are in the process of working on developing a multifaceted native school mental health curriculum. And we are looking for partners when it comes to that. We have also published a best practices based on experience-based practices, as well as school-based, community-based practices when it comes to mental health for K through 12 kids in schools. And as we know, if we can get the kids help in the school environment rather than taking them out, driving them to an outpatient clinic, we know that it's much easier to maintain the students, to help support them. So how we do this is very important, and I think we are working with tribal communities on figuring out how can we do this. Because we of course know that there are schools, there are boarding schools, there are a lot of different educational institutions in tribal and urban Indian communities. One thing that I want to highlight here, two things. This K through 12 supplement was given to us because people really thought that we needed to support schools because of all the shootings, all the things that happened in schools. And we discovered very quickly, and even before we submitted the application, that this is not the major issue necessarily in tribal communities. Yes, there are people, and we've had shooting incidences in tribal communities like Red Lake, for instance. But a lot of the atrocities that come in a school environment in urban Indian or tribal communities are associated with bullying, with domestic violence, with other things. So what we decided to do was to develop a program that we call a Crisis and Resiliency TA project. And this is a project where we have two tribal communities in different parts of the country who, together with our support, have been able to develop a system within their tribe or their urban Indian community that consists of a team, that in case there is a trauma, and the trauma is defined and making people in the tribe or in the urban Indian community very upset, then they have a plan for how they're going to address this. And what our job has been to give the tools to the two communities. We have had, of course, on-site visits and continued TA, and then have them develop their own plan, develop their own way of collecting data, develop their own way of developing an infrastructure. We're going to be offering this again, and now since we can't do all our face-to-face, we will do a hybrid of this until we can do the full-fledged program, which means we will at least have 2 meetings with staff and community members in the communities we were working with. We have discovered that a lot of kids in tribal communities as outside tribal communities have telephones, and that sometimes when we do telehealth, we have to have a lot of equipment, we have to have a lot of red tape that we have to cross over. What we've discovered, and we've already started, is that if kids with mental health issues and counselors in the schools would be able to communicate through a platform that is HIPAA approved and meets all the standards, then the kids may have easier access to mental health in their school. So we have started a telemental health project, and first we are going to have a 7-week program that started this Tuesday of this week, and then have support from our experts on how to do this. And we've had a lot of interest, and it's going to be very interesting to see how this goes. I'm very optimistic and interested in sort of sitting on the sidelines and supporting this. We have, by the way, also done a needs assessment about Native communities with experiences on trauma incidences and what we can do to support them. This is not systematized yet, but we are in the process of creating a report. So those are things that we would share with you all. The final center that I wanted to go through is the National American Indian and Alaska Native Prevention, TTCs. And we have the same geographic regions as we have in the other centers, and here is our staff. And I just want to highlight that Dara Jefferson is used to be a staff member in our center and is now back as a PhD student, and we are very excited about that. So you will hear more from her, I can guarantee you. Here is it again, the map, but again, the PTTC and the 2 other TTCs may overlap in region, but may have different organizations they work out of. But again, please reach out to all of these because you are in the region, and they are to provide services and TA to their community members, which includes tribal and urban Indian, as you know. We have very much the similar structure with monthly webinars, but then our manager of this project, Cindy Sago, who is also a tribal member from Ghana, sorry. She decided she liked this idea. If you remember that SAMHSA gave us or developed under leadership of Captain Hunt a culture card that you can fold out, and you can really see a lot of information on those culture cards. She decided this was a great idea, so she has developed 3 culture cards with the headline of Culture is Prevention. And the last one was on issues of use of tobacco and use of tobacco for spiritual and ceremonial reasons. The next culture card is going to be very much how to work with tribal communities and with a frame of community-based participatory programming. If you're interested in these, they fly off the shelves. So you can access them on our webpage. However, we also can send you some if you like them to have them on hand. And of course, we were going to share this with all of you at the conference in Nebraska a couple of weeks ago, but needless to say, change your plans. We're going to use our collaboration with Dr. Bigfoot for two projects. One is the project on working with children with trauma. The other one is working with teachers in the classroom on how to manage classes that consist of Native American students mostly or some. And that project came out after I had been traveling to some schools in Indian country and observed teachers who were non-native and didn't really have the knowledge of how to work with Native kids. And I thought this is a real need. We need to support our teachers in K through 12 working with kids whether or not they are Native, but in a way that is culturally informed. So we are you're going to see more of this when we have our subcontract finalized. We are collaborating with Tribal Tech to provide GONA training. But again, I worry about where that is going because of the social distancing initiative or expectations. What we also have decided is that we want to offer the Native American Substance Abuse Prevention Skills Training, SAPS training, as often as we can. So this year we have had 3 of them in a different region. I think we've been in Rapid City, we've been in Alaska, or not in Alaska, we were going to Alaska, I'm getting confused. We have been in California, but again, we are trying to work with our Native trainers to figure out how can we do this if we need to do this via a virtual method. It's a rather difficult thing to do because there is so much, what should I say, interaction and collaboration. So, yeah, we'll see. Stay tuned, but that's a very good project. Also, we have newsletters, and of course, we provide quite a lot of technical assistance to tribal communities. And I heard so many members on the call get the 14-minute, 15-minute bell to remind us that it's 15 minutes left of this. But I am now going to turn it over to you. I've run through a lot of this, and I'd love to hear what kind of questions you have.
Thanks so much, Dr. Skinstad. We have had a couple of questions, which I've responded to a little bit in the chat, but I'll share them here in case you have anything you want to add. So someone had asked about our programs being available to urban Indian programs as well as tribes. And of course, yes, we serve any Native populations, no matter where they are in the country. So we love to work with both urban Indian and tribes that are in their own communities. We had another question about mental and behavioral health resources for Natives coping with COVID-19, especially for elders and young ones.
And I would like to address that because
Great.
it's a very, very, very important question. And what I can tell you is we are, I think, going to offer some Q&A sessions and for elderly and providers. We haven't completely figured out how to do this, but I totally agree. I am very worried about our elders and how we can reach out to them and support them in this time of social distancing. And also the issue of if you get symptoms, you can't even go to them. That's what this social distancing means. So, you know, the elderly population is a population we're very worried about. So if you have any suggestions of themes that would be important for us to bring up, we are in the process of developing an extensive elder project, and I know that Jackie Gray is on the line, and she will be one of our collaborators. So, but in the immediate, we're trying to figure out how we can support them. Yes.
Yes, and I wanted to mention too that I will be sending out an invitation either today or tomorrow to a series of spirituality roundtable discussions, and we had our first one last week Friday. They're going to be every other Friday, so next week April 3rd will be the next one, and then these will be from 1 to 3 p.m. Central Time. So we'll be offering these regularly, and we bring together a number of spiritual leaders and elders, healers, medicine people, and a lot of the things that have come up last week were in response to how the communities are doing, dealing with the coronavirus. And so that conversation, I'm sure, will continue, and that'll be a really great opportunity, I think, to ask some questions about that and see what these leaders in various, coming from a variety of communities, have to say about that. So if you are not currently on one of our listservs, if you want to put your email address in the chat, I can add you to that so you make sure you get those announcements.
Thank you for reminding us of the Spirituality Roundtable, because we've done this for quite some time in various formats. So this is not the first time we've done it virtually, but of course, as we all agree, discussing topics like that is so much easier when you see people than when you start fumbling and try to jump into a discussion where you can't see people. But this is what we have, and I was very surprised, as you were, Kate, that this was very successful last Friday.
Yeah, wonderful. I see a lot of people are adding their email addresses. That's great. I will add you to our listserv so you'll receive all of those announcements. And in addition to our regular webinars, you'll hear about those there too. So there'll be lots of opportunities to connect and to find more resources and things that are going to be helpful at this time.
It's a challenge for all of us, and I'm sure one way to really connect with our elders is really to make sure we have maybe 1 or 2 phone calls with them. I know some schools have Zoom meetings with the kids in class to just keep contact with them and have the kids be able to communicate with each other, because it's very hard on the kids too.
Yeah, so someone just asked about during this time of, or regarding technical assistance for telehealth. So we're getting a lot of background noise here.
I don't know where this came from. Yeah.
So what are the thoughts on HIPAA compliant Zoom as opposed to a dedicated computer with a camera? Angelina, do you have any thoughts about that? How things can stay HIPAA compliant, or have you heard conversations about those kind of things as far as best practices for telehealth?
Yeah, the first started is indicating best practices, and telehealth. I know that the platform is approved for telehealth and is also secured. Okay, why is it so noisy?
Let me see if I can fix that here. Sorry about that.
Okay. That sounded better. You must have done something, Kate.
Yeah, like I said, I wasn't able to set up all of our regular settings in the beginning, and so normally I mute everyone at the beginning, and I've had to sort of do that ad hoc here, so sorry about that, but now I think we've got better sound.
Yeah, but the question about telehealth, I want to go to our collaborator on that before I answer, because this platform they are using is over the phone, and whether it's over Zoom or whether it's over a different platform, I'm not sure, but I will make sure that people know about this resource. And if you are interested, this is something that we have actually started how to do, and it started Tuesday, and the implementation of this specific use of telehealth will start in May. As you might have imagined, I'm not the techie person in our center. So I'm sorry I didn't have more of that information for you guys.
Yeah, that's a great thing to bring up. I think a lot of us are trying to figure out, how to roll with some of these changes, and so I think some of those conversations will be had as we sort of bring in our experts in IT, and we'll rely on them a lot for some of that information. So we hope to bring more information on that in the future.
But here is one thing I suddenly remember, Kate. We have a handout, an overview of this project with an overview of the platform, and I'm wondering if people online would be interested in us sending that to you so you can see what it is.
Okay, yeah, I can make sure we add that to our follow-up email. So
yes.
Since we have everyone who registered, we will send a follow-up email with the link to the recording of this session in case you want to share it. And then we can add that as an attachment. So watch for that as well.
And here is somebody asking for more on the project enhancement and the culture cards. So all of this is on the webpage. isn't it? You can click on the web page, Kate, for that kind of overview and the culture cards.
Yes, and I will, I'll make a note here to add links to those things in our follow-up emails as well, so we can direct you right to those things, so you don't have to search around.
That's right. Mm-hmm. And here is someone who, Barger, it does not include HIPAA compliant Zoom. And you know, what I want to say about this as well, we are doing the platform over phone that is HIPAA compliant, but the federal government has, in this very serious pandemic, loosened some of the HIPAA requirements. So I don't know exactly where that document is, but it is supposed to be on the SAMHSA webpage. And so we will see if we can find also reference to those changes that have been made because of this pandemic.
Wonderful. Well, I think we have another webinar we need to get to, and we're about at the end of our time. So want to thank everybody for joining us, and thank you so much, Dr. Skinstad, for presenting and sharing all this information. And I meant to ask Glorinda Siege if she has anything she wanted to add. Just wanted to thank you again for inviting us to present here, and now I've unmuted you if you wanted to say anything here too. Glorinda, are you there? Okay, maybe we don't have, maybe we haven't connected yet. But I think we'll close out here, and please just send us your questions if you have any other questions. And while we close out here, I will redirect you to a short survey. So if you wouldn't mind taking a few minutes to let us know what you thought of the presentation today, and if it was helpful, and we would really appreciate that. So you should be redirected to that. And again, we want to thank you so much for joining us, and look forward to connecting with more of you again in the future. Thanks a lot.
And thank you for spending an hour with us in this very hectic and stressful time of our lives. Hang in there and stay safe and healthy. Thank you.
Wonderful. Thank you.